Hello student, welcome to the session. After understanding the basics of the triaging, soft tissue injury and the shock, we now move on to the most important and a very interesting session of the beginning of orthopedics, that is principles of fracture management. So this talk is actually designed to discuss the principles of fracture management, but before we move on to the fracture management, we would also introduce you to a couple of the basic terms which you would have read during your days of anatomy, pathology and physiology. And then we will move on to discuss the principles of fracture management and followed by a certain special situation. So at the end of this session, which we will try to take in 3 parts, the students will be able to understand 1, the basics of bone in joint. And what are we going to discuss with this is anatomy, structure, blood supply, ossification, growth, physeal structure and a bit about type of joint. Because I will be bringing in lot of terms, endosteum, periosteum, physis, growth, nutrient artery and so on and so forth during the next entire traumatology discussion. And if you are not well versed with these terms which you had read few years back, it will be difficult for you to recollect. So I am going to do the recollection step. We will also discuss a bit about type of joint, but we will not go into detail. Once we finish that, then we will move on to the principles of fracture management, where we will discuss the definitions of fracture, classification, clinical feature and the management of fracture, along with a special note on a special type of fracture which is known as intra-articular fracture. That means the fracture which goes into the joint. And lastly, the fracture healing, its process and what are the factors which control the fracture healing. Then we will take up in the 3rd session some special conditions or some special fractures like stress fractures, pathological fractures and physeal injuries. So this is a pretty long session. When you are watching these sessions, you can always divide as per your interest at the moment what you want to watch. So let's say you just want to watch the principles of fracture management, go only to that session and watch. But I would request that basics of bone and joint are extremely important if you further want to understand the principles of fracture management. So let's proceed. So if you look at a bone, how do we define a bone? What is exactly a bone? So bone is a rigid body tissue which consists of cell embedded in a very rich, abundant, hard intercellular material with 3 principal components. So if you look at the whole bone, it has got 3 important things. One is the cell, second is a lot of collagen fibers, and thirdly the calcium phosphate, which we also call it as hydroxyapatite crystals. Why do we need a bone all across the body? One of the fundamental function of the bone is to provide a structural support to the body. It gives you a framework, it gives you a shape and it gives the structural support and a point of attachment to the muscles so that it can act, contract and it can transfer the power across the joints. Second is it provides lot of protective framework, protection for the important delicate structures which are housed inside the lung, like let's say you have a heart and you got lung. Let's say vertebra, so inside the vertebra you have got the spinal canal where you got the spinal cord, and in the abdomen partly under the rib cage you got the spleen and the livers. In the pelvis you got a lot of soft organ, the inner true pelvis. So likewise the bones provide lot of protective structure. Third is it also gives protection to the hemopoietic tissue which is inside the marrow. And lastly, it is one of the biggest mineral reservoirs, especially the calcium. So calcium is not only required for the strength of the bone, but bone also acts like a reservoir, because you must remember that calcium is not only required for the bone, but it is also required for many more functions in the body, such as neuromuscular junction release, the calcium is released, the resting membrane potential maintenance. So calcium acts like a membrane stabilizer. Whenever you have a hypocalcemia, it can lead to tetany, and whenever you have a hypercalcemia, the membrane polarizes so much so that it becomes difficult to excite. Calcium is also required for the cyclic AMP pathway. Calcium is also required for the muscle contraction, whether it is smooth muscle or skeletal muscle. Calcium is also required for the coagulation mechanism. So hence calcium is required for many more functions rather than just giving a rigid structure to the bone. You will come across these terms: flat bone, sesamoid bone, long bone. So this is one bone classification which is often used. Long bone. What is a long bone? So long bone is a bone when it is longer than the width. Short bones, length is almost same as a breadth. So you have the carpals and tarsals, which could be, something like where it is almost equal. Flat bones, irregular bones, and the sesamoid bone. Sesamoid is a bone which develops into the tendon or muscles, and the largest sesamoid bone of the body is patella. You will also find the sesamoid bone here near the thumb. So if you see the thumb X-ray, you will find two small bones here. Same thing you will find near the head of the first metatarsal. From here we move on to anatomy, and these next couple of slides will be only the basics. I am not going to take you into the depth of the very boring and intricate things which you probably have read in the past. It's just revisiting few terms which you have read in the past. What are the various parts of the bone? Epiphysis, metaphysis, and diaphysis. What is epiphysis? What is metaphysis? What is diaphysis? So the term is basically physis. The main term is here, common term is physis. What is physis? It is the growing end of a long bone. Part above, that is epi to the physis, is epiphysis. Part below is the meta to the physis, right? And diaphysis is the end which connects the two metaphyses. That's a diaphysis. Do not get confused. Physis is a completely different term. Physis is also known as a growth plate, where the longitudinal growth of a long bone happens. That's known as a physis. So epiphysis is epi to the physis. Metaphysis is below that. So this is metaphysis as it is indicated. This is epiphysis, and this is physis. Another term which will be used very often is a compact bone and a cancellous bone. Compact bone is also known as a cortical bone, and spongy bone or a cancellous bone. So the outer part of almost all the bones are compact in nature, whether it is a long bone or a short bone or a flat bone. So if you see the calvaria, the cranium, the outer part is compact, but inner table is cancellous in nature. So in a long bone, if you see here, that white shadow is basically the cortical bone or a compact bone, but here this is all the end of a long bone. All the long bones, their ends are spongy or cancellous in nature. Compact bone usually has got a very high compressive, bending and rotational strength, whereas spongy bone usually has got poor strength, hence it is lesser dense. So it has got a spongy network, where the trabeculae fuse. So trabeculae will fuse like this during the development process, and they form a very spongy structure, somewhere like this what you see here. Next we move on to what a bone is composed of. So principally bone is made up of two tissues. One is the cell, second is the matrix. Among the cell there are four types of cells. Cell 1 is osteoblast, osteocyte, osteoclast, and lastly undifferentiated mesenchymal stem cell, which usually differentiate into the osteoblast. Now all of you know what is an osteoblast. So osteoblast is a cell which is principally responsible for forming the osteoid, or it lays down the matrix in which the hydroxyapatite crystals are deposited, which is going to harden the bone. It is controlled by BMP. What is BMP? It is bone morphogenic protein. It is very rich in alkaline phosphatase. The osteoblasts are very rich in alkaline phosphatase. And how do we use this information? Any condition where the osteoblastic activity is high, the ALP goes higher. And which are that condition? So let us say post-traumatic, when the callus forms, ALP is high. Infection, acute osteomyelitis, there is a lot of periosteal reaction, lot of new bone formation, ALP will be high. Tumors, which tumor? New bone forming tumors. Which are those? Osteosarcoma, Ewing sarcoma, ALP is high. Some metabolic conditions like let's say the Paget's disease, ALP is high because it's a dense new bone formation condition. So ALP, whenever the bone ALP is high, which again this is all your MCQ. In which condition bone is ALP is high? So in trauma, tumor, infections and metabolic condition, but you must know which are those conditions. The tumors which are excavating in nature, there it is the clastic activity which is high, so you don't get a high ALP. It produces a type 1 collagen and later after its activity a osteoblast gets converted into osteocyte. What is osteoclast? Osteoclast is a bone resorbing cell and these two cells are extremely important. So one removes and one forms. It is important for the normal remodeling process of the bone. Osteoclast is very sensitive to PTH. PTH is parathormone, means whenever the parathormone levels are high in the body, they stimulate the osteoclast and osteoclast start removing the bone. This is seen in hyperparathyroidism, one, or a situation where there is a hypocalcemia. So when the calcium levels go down, immediately it will stimulate the parathyroid glands. From there the parathormone is released and this parathormone stimulates the osteoclast, which will remove the bone, taking the calcium out of the bone, releasing it to the circulation. Because as I told you, calcium is extremely important for other metabolism also, apart from giving the compressive strength to the bone. Osteocytes are for maintaining the homeostasis.